Hey, everybody. Type in the comments if you can see me. It should be coming up. You might need to refresh your screens in order to see it. Darn it. Drew, maybe you could put that in the comments.
I got you.
Anyway, welcome to this webinar. I'm so excited that everybody's here. Looks like there's a bunch of people in the room, and that's really exciting. Hopefully you can hear me. I'm not sure that it starts on its own. So again, if you can hear me, if you could just type in the comments that you hear me, that would be great. I'm so excited that everybody's here. All right, we're going to give people just a couple more minutes to file on in. In case we have some late arrivers. Anyway, it looks like people are here. All right, so excited to be with you guys. Oops. Hey, Jasmine. Awesome, thank you so much. All right, so welcome to this webinar, and I'm super excited to be sharing it with you guys. Obviously, that is me. I'm Hillary. Hi, I'm Hillary. That's me. That's my nurse's outfit. We just changed to having to wear navy at our hospital, so I'm really bummed about not being able to wear my super cute scrub tops, but I'm moving on. So I bet you're wondering, why do I have the ability to give this webinar? And that is a good question. I think that's something you should ask of anyone who gives a webinar. I graduated with my Bachelor's of Nursing degree in 1998 from Brigham Young University. And I worked for a nursing home and hospice and for a pediatrician for the first little bit of my life. And I enjoyed all of those somewhat. I think I like the pediatrician's office the best. But in 2001, we moved to California, and I made the change to labor and delivery. We moved to San Jose, California, and that's where I started in labor and delivery. And I love labor and delivery. It is definitely my home. I enjoyed the other aspects of nursing that I learned, but I'm excited to be at a place that I love. I run the blog Pulling Curls. That's probably where a lot of you know me from. And I do have my own prenatal class that I sell there. And I continue to work in the Phoenix area part-time as a labor and delivery nurse. Although I actually work in Scottsdale, but I do for the internet, I work in the Phoenix area. And I just work 1 to 2 days a week, depending on what they need, 12-hour shifts. And I love pregnancy. It's one of my favorite things in the world. I think it's fascinating how the body compensates for different things in pregnancy. And I think it's super interesting. I love going to seminars and stuff for my work, and I like sharing about pregnancy on my blog. They're some of my favorite posts to write. But one of the hardest things for me in labor and delivery is how I get frustrated by how doctors sometimes treat their patients. And so I wanted to share a little bit of my own birth story. And but before you roll your eyes and you're like, oh no, another birth story, I want you to assure you that I'm going to tell you about the #1 birth fear at the end of this webinar, so stick with me. All right, back to me. I was 12 days overdue with my third baby, and I was adamant that I did not want to get induced. And this is an awesome picture of how great I looked when I was 12 days overdue with my third baby. That was the furthest I made with any of my babies, by the way. So yeah. Have any of you guys ever felt that your doctor was pushing you into something you didn't want at any time? Tell me in the comments. I'd love to hear about it. For me, my doctor really wanted me to get induced. She wanted me to get induced at 1 week past my due date, and I refused that. And then when I was like 10 days overdue, she really started to push me. And that was difficult. It was something I really didn't want to do. I'm not a fan of induction. If you've read my blog, you probably know that. I do think that there are definitely reasons to be induced, although not as many as some doctors would like to choose. Anyway, if any of you guys have something that your doctor was pushing you to do, tell me in the comments. I'm interested to hear. And some of you might worry that your doctor will push you into something that you're not interested in. So I think we're going to talk a little bit about that tonight. So as ludicrous as it sounds, I really felt that way. They came in to break my water several times, and I kept saying that I did not want my water broken, and that was something that I didn't want. And because it happens all too easily, I didn't want it to happen to me, that I would end up failing my induction and end up having a C-section. So I will disclose, though, before that, I was pretty much a mess. I was 12 days overdue. I didn't want to be induced. I was hurting. I had had kidney stones, and my pelvis was splitting, and I was crying most every day. So I definitely had some emotional issues going on besides just being overdue and pregnant. Has anybody else felt that way during their pregnancy, where they're super emotional and sometimes their emotion gets in the way of their decisions? Tell me in the comments. I'd love to hear it. And the comments are just down below. There's that worksheet you guys can grab, and then the comments are below that in the discuss section. All right. So what seemed like endless talking, I finally ended up letting them break my water. And within an hour, I had this little gem, and her name is Paige. She's one of my absolute most favorite things in the world. But after 4 years of trying to get pregnant, along with being 12 days overdue, she reminds me that things often don't happen according to plan, but are still delightful. But she still doesn't follow plans very well. That's her. She is 6 now. She'll be 7 on Friday. But life goes on, right? Everything is always in flux. Now, I can hear you saying, Hillary, you're a nurse. Of course you could get what you wanted. And to an extent, that was true. My doctor was probably a little bit scared of me. But I still had to fight to get my voice heard in my labor room about what I wanted and what I wanted for my body. So this was my nurse, Kelly, and she was great, super nice. She was very reassuring. And this is my doctor, and she was probably a little scared of me, but also very nice. I mean, she never pushed me to do something that I really didn't want to do. So here we are for our 5 key tips to getting the labor that you want. And I think it's time to put some keys on your key ring, right? All right, first step, speak their language. What you're going to want to do is to find out about labor and to learn the basic medical terms that are used in labor and delivery. Now, I'm not saying that you need to know how to deliver your own baby, but if you do, all you need to do is pull down, release the shoulder, and then pull up, and the baby comes out. It's just that simple, sort of, unless something goes wrong. But I'm saying you kind of need to speak their language in labor and delivery. So there are some ways to speak their language. First, you could take a hospital-based prenatal class. Hospital-based prenatal classes gets you used to your hospital. It's great because you get to be on the hospital campus and see where the labor and delivery is. Usually it's close to labor and delivery, or they give you a tour. It's taught by trained staff. Most often those are taught by labor and delivery nurses. And so that's nice. They'll cover what your doctor wants covered. I have actually taught hospital prenatal classes, and they were specific about what they wanted covered by my doctor. And so that's nice for you to know, to be speaking the exact same language as your doctor. And they speak your hospital language, and every hospital kind of has their own language, not really like French English, but their own terminology. And even areas of the United States, they have like the East and the West speak different kinds of languages in labor and delivery, and so it'd be nice to have your hospital language spoke in your prenatal class. Oh, let's see, Jasmine. Just reading your question. Oh. So we'll talk more about your scenario at the end. Bring up that question when we get to the very end. But if your water breaks, you do kind of have to get induced. But we can talk more about it later. Let's see. Where am I? All right, there we go. There's lots of different couples in your hospital-based class, which is kind of nice. Sometimes they come up with questions that you wouldn't have had that you thought are good questions, so that's nice. Cons, you have to go by their schedule, and our hospital fills it very quickly. We're only allowed to have like 8 couples in our labor and delivery classes, and so there aren't very many of us to teach them, and they fill up very quickly. Sometimes they're taught in stuffy rooms with hard seats. Ours is taught in a very small room with a bathroom right off the room so everybody can hear you tinkle, and the seats are not super comfortable. So, yep. There are lots of different couples in the class, which is a pro and a con. So sometimes those couples have weird questions that you don't want to hear the answer to, or they want to share all of their vast labor knowledge with you, and that can be frustrating. That was frustrating for me in our labor class that we took with our first baby. And they can often be super boring. A lot of times these are nurses, not teachers. They weren't meant to be teachers. That's why they became nurses. And so that can be a problem too, because you don't want to sit there totally bored for a long time. Okay, another way that you can speak their language is to take a community birthing class from either a doula, Lamaze, Bradley, something like that. One of the pros is that it's extra good if you plan to go natural. Doulas or lay midwives are often good with those types of things. They're usually taught inside the person's home. They're a little bit longer and more intensive. I know our prenatal class is only 3 nights, and most home or community-based labor and delivery classes are 5 to 10 nights. So that can be a little bit longer, which can be how much you want to know or learn. They're willing to answer many questions, so they often have a long time, and they love labor, so they want to answer everything about it. Cons, sometimes it's difficult to know their level of knowledge. You might have a doula who's just done a couple deliveries who decides that they are ready to teach prenatal class. Or you might have a doula who's done 1 million deliveries, and it's kind of hard for you to tell because there's no like eBay rating system for doulas, so sometimes that can be difficult to tell. Sometimes they can place their labor beliefs on you. I know I've had friends who did the Bradley method who felt like they felt guilty for the things that they did, like had an epidural or had a C-section, and that's not a good feeling. So sometimes that can be a problem. And they're often taught in their homes, so that can be a good thing or a bad thing, depending on their home environment and if their kids are running around. I've been in labor classes where they're also the only parent that's home, so that's interesting. You can also learn on the internet. Pros of the internet, it's easy to do. I think we all know that. You're here with me. There's a large knowledge base online. There's definitely plenty of information online, and you can do it whenever. You can do it wherever. So you have to be of your accuracy. You're never sure exactly who's giving you the advice or how much education or knowledge they have. If they might say that they're a nurse, but that doesn't mean that they are. And they might be an expert in their own birth, but they might not be an expert in birth in general. So that's something to take in mind. And they might not speak your hospital or your doctor's language. I know there is a big difference between labor and delivery in the United States versus labor and delivery in other countries. So that's also something to keep in mind. So have any of you ever felt like you weren't speaking the same language as your doctor? I'd love to know in the comments. That would be interesting. And I'm going to keep going on, but I'd love to hear what you have to say. And there will be a time for questions at the end. So that will be awesome if you guys have specific questions. I can certainly answer them there. All right, regardless of whatever way you choose, I would still recommend learning their language, and we can talk a little bit more about that later. And we're going to move on to number 2, stay close to nature. So you're saying to me, Hillary, I don't want to deliver in the forest. And boy, oh boy, do I not want you to deliver in the forest either. But I am saying that I would recommend to stick to what your body is doing naturally. When the choice is between induction and waiting, I choose waiting. Except obviously when I was 12 days overdue and had a lot of risk factors, I did choose to be induced, as we talked about earlier. And this doesn't work in every situation, but it is a good way to start. So that's it for number 2. I really think that the closer you can stay to whatever your body's doing, stick with that unless there's a reason. If you have PAH, diabetes, any other risk factors, then you definitely want to talk to your doctor. I mean, all of this you want to talk with, but I think that is one of the keys to having the labor you want, is by sticking close to nature. If you have questions, please post them in the comments. All right. Number 3 is to find a great doctor. And I know that that ship has sailed for most of you. Here we are with a beautiful ship. But there are things that you can do now. In reality, there is a good chance that your doctor is not going to deliver you. And so it would be important for you to find out who takes call for them when they're out of town, on weekends or on nights, just so that you know. I would ask your doctor about their partners. So that's usually who takes call for them, but not always. Sometimes a couple of practices will join together for night call. And you'll want to ask them, do they usually do episiotomies if you're against an IV, or if you're against other areas of labor, you're going to ask the doctor how their partners will deal with that request of yours, because every doctor practices very differently. And you're going to want to learn to work within your doctor's parameters. There may be things that they are just not comfortable with, and so you need to be okay with some of those things, because they you know, they can't force you to do anything, but they can definitely do things sometimes. So I would be very clear with your doctor about what you would like to see, and if they can help, or what would you like, and see if they can help you with that. If not, see what they suggest or why they don't do those things. So let's say that you would like to have a VBAC, and there are some doctors that adamantly will not do VBACs. A VBAC is a vaginal birth after cesarean, also called a TOLAC, trial of labor after cesarean. And some don't do it because they've seen poor outcomes, and that's their choice. If you've seen a mom have real issues, you might not want to perform something like that either. Even if you and your doctor don't always see eye to eye, you can learn to appreciate each other's viewpoints. But up until about 30 to 34 weeks, it is fair to doctors. Doctors will readily accept you unless you have a lot of problems before that time. But I would definitely call your insurance, because sometimes will pre-approve you to be with a specific doctor, and if you change, that can be problematic. And there's one more word of advice. You may need to prepare that you don't like the new doctor much more than the last one. And so some of it may be the emotionalness of pregnancy, and some of it just may be your feelings towards the medical establishment. But if you're past 34 weeks, you're going to need to learn to love, like, or tolerate the doctor that you have. There are a few physicians that will allow switching past 34 weeks, but not very many. If you're super low risk, then they might consider taking you on. And if anything, you've learned a lesson for the next time. So if any of you have comments, please post them in the thing. Taryn, it sounds like you don't understand some of the things your doctor's telling you. Yeah. After doing the research, you feel like you're more on the same page as them. So that makes sense. But we're going to talk a little bit more about that type of situation in the next one. I think it's the next one. Yep, it is the next one. All right, so here we go on to number 4. Oh, we have another comment. Yes, I agree that finding a great doctor can be really, really difficult. And I do have a post about finding a good OBGYN in my blog. My husband's monitoring the comments, so maybe he can put that in the comments for you guys. Number 4 is to use informed consent. So Taryn, I think this will help you a little bit, and it'll help everybody because informed consent sounds really technical, but it isn't. From the dictionary, I got the definition, which says permission granted in the knowledge of the possible consequences, typically that which is given by a patient to a doctor for treatment with full knowledge of the possible risks and benefits. So, whoa, that's it's a definition. But basically what it means is it's the doctor's responsibility to tell you the risks and the benefits of the procedure. So that sounds super helpful, right? And with a good doctor, it really is. But a lot of doctors don't do it correctly. They feel like they are too busy to actually give full informed consent. So we're going to talk a little bit about how informed consent is obtained by your doctor or your midwife or any healthcare provider that you have. They are required to chart that they have obtained informed consent before a procedure. So definitely before a C-section, a tubal ligation, any of those big procedures, they're going to say that they've obtained informed consent. Also, usually in the office, they'll talk about like the possibility of needing blood or something like that, and they'll give informed consent about that in the office. Okay. So informed consent includes explaining the procedure. So they're going to need to go into how the procedure will be performed, what they'll do, and how long you'll be recovering or healing from it. So with a C-section, they're going to say, first we're going to go into your skin, then we'll go into the next layer, then we'll spread your muscles apart, then we'll go into the uterus, a small hole, and then we'll suck out the fluid, and then we'll pull your baby out. And then we'll sew everything back up. They should go into the whole procedure. Then they'll say there's about a 6 to 8 week recovery period. For the first week, you're not going to be doing a whole lot of movement around your house. You're going to need help, all that kind of stuff. So that is explaining the procedure. They should definitely go in depth into what will happen in the procedure. Informed consent also includes explaining the risks. And they will go over every risk with you. Well, not every risk, but the majority of risks that could happen in the procedure. And it will likely end in you could die. And that is how almost all informed consents end. Obviously, most people don't end up dying, but for your epidural, an informed consent will often end with you could end up dying. C-section, tubal ligation, all of those are going to end in and you could die, just because it is a chance that you could die. Of course, they don't informed consent you about driving to the hospital, which is actually the least safe thing that you will do in having a baby. Informed also explains the benefits. So they've just gone over all the risks. Now they're going to go over the reasons why you would want to do what they're recommending. So why do you think they should do it, and what kind of good things, which is really good because they just told you all the bad things that could come out of it. So with a C-section, they're going to say, I don't think your baby can come out your vagina. I think we'll need to pull it out of your, have a C-section. And the good thing that will come out of it is a healthy mom and a healthy baby, because we feel like labor could be of risk to you or your baby. And so you need to think of all of informed consent about an education for you, and it's not a time to be scared. Okay. They should also explain the alternatives. So in the C-section scenario, the alternative would be to continue laboring for a longer period of time, and then they would explain the risks of that. There should always be an alternative that they give you. So there are other things that they could try. They could also try like giving you an epidural, or what would be your other options, okay? Informed consent should also answer any questions. So if you have questions about the procedure, the alternatives, the benefits, your doctor should stay and answer those for you. That isn't to say that they won't leave the room and let you guys think about it, but they should answer any of your questions before the procedure. And when informed consent is done correctly, it will allow you full weight in making your own healthcare decisions, which I think is really exciting and important for you to feel like you've had your way in how it's your body. When it's done wrong, you're left unclear of the best choice, or if you have a choice. A lot of times the doctor will walk in the room and say, I think it's really important that we have a C-section. I think your baby might die. Do you want a C-section? And then you're like, I guess so. And then they leave the room. And that is not informed consent because they didn't inform you of the risks, the benefits, and all that type of thing. So let me be very clear. You always have a choice. Unless there are labor nurses swarming your bed, it is an elective C-section where you definitely have a choice, and you can make a choice to wait or continue going in labor. And I think that's important, that you do always have a choice, and it is up to you. It's not up to your doctor what you're going to do. So do you have questions about informed consent? I'm happy to answer them right now. It's kind of odd because my audio is like 30 seconds ahead of your audio, so I want to answer any questions you guys have. But there's a big break between me and you. So keep asking them in the comments and I'd be happy to answer them. Again, we'll have a question and answer period at the end of the webinar. All right, number 5, be flexible. Not that kind of flexible. That's how you got pregnant in the first place. I wanted to share one of the truths that I've learned. And delivery nurse, you ready for this? When you make a plan, God laughs. If you find yourself inflexible about what will happen in the labor and delivery room, it will always end up happening to you. So if you say, I don't want Pitocin for any reason, you will end up needing Pitocin. If you say, I don't want a C-section under any reason, you will end up needing a C-section. I don't know why it is. I'm not a fan of it, but I've just come to terms with that is how it works. And that's my number one advice actually for you in labor, is to be flexible about the things that will happen that day. And oh, Taryn, it looks like you don't feel good about how things are going in your care, so that's not good. Definitely you don't have to do with whatever they said. So I would even use the words, I heard that I'm not feeling informed. I've used the words informed consent because they have to chart that they've given that. All right, so back to being flexible. So keep being flexible in line. Maybe you should get a tattoo of it for labor. Maybe like a temporary tattoo. I don't think you'd want to be flexible tattooed on you forever. But and if you guys have questions about staying flexible, I'm happy to answer them. You can ask them now and I'll answer them. But I do really want to quickly circle back to number 1. For the longest time when I taught my own prenatal classes, people wanted to share me with a sister or a friend. I got people who really enjoyed my prenatal classes, how down to earth and realistic I am about labor and delivery. My classes were quick, to the point, they were fun, people enjoyed them. And now people can. I do have a prenatal class that's available. You can click on the link to the side webinar that's rotating through my different pins that are for that. In this class, you get 11 chapters. There's information from the 3rd trimester testing up through bringing the baby home. I get right to the point. It's about 60 pages long, the written part, and then I also have a workbook, a couple's workbook that comes after it. But I definitely get right to the point. I'm not wasting your time. The full package, which is the higher package, also includes videos, and I explain key points in the videos. Outside links to help you understand each concept further. There's also couples questions for you to answer together. I think one of the most important parts of a prenatal class is making sure that you and your partner are on the same page for this delivery and for raising this child afterwards. So I have a lot of questions for you guys to answer together. The online course can be taken on any internet device or downloadable. There's a downloadable ebook that you could put on your Kindle as well. And the best part is that it's available anytime, anywhere, on any device, which is nicer than a labor or a prenatal class at your hospital. And you can finally take me with you and I hope we're going somewhere fun. Although I doubt it, because you're probably very pregnant right now. Oh, we have a question. Let's see. Oh, Jasmine, I'm so glad you liked the first chapter. That's sweet of you to say. Let's see. So after the prenatal class, you will feel like you finally speak their language. You'll feel like you understand the birthing process. You'll have a pretty good idea about what happens on delivery day. You will have a good idea of what you'll be experiencing after the baby and how you can best take care of you afterwards. I know even for me, we bought a house we moved about a week after I had my second baby. And even I forgot that I wouldn't be able to like lift boxes and stuff like that. Apparently I left my labor nurse brains somewhere else because you need to take care of you. You've just had a big thing happen to your body. So you're gonna need to take care of yourself as well as your new baby afterwards. You will feel empowered to make good healthcare decisions. And hopefully we've talked a little bit about that tonight. And you can feel as ready as you can be. My full edition does come with a money-back guarantee that if you finish the full course and don't feel more prepared for labor and delivery, I will give you your money back, no questions asked. And here is the link. I'll have my husband put the link in the comments as well. Actually, you can just click on the ad that's to the side. I'm not here just to sell the class. I do think that this webinar goes over some really important things that hopefully prepares you for your delivery as well. Oh, there are 3 different editions. There's the basic edition that comes with just the book. There's the community edition that comes with a Facebook page where I can answer your questions during it. And then there's the deluxe full edition, which I do update frequently. Little brain fart there. I do update the full edition frequently. There are videos. And you also get the Facebook group where you can ask me questions. And the pricing tends to fluctuate. It's a great price today, especially for the basic edition. So, but if you order, I put in the next hour, but I mean, if you order through the end of the night, so that gives you what, 6 more hours or so. As a thing sticking with me, if you use the coupon code WEBINAR, WEBINAR, you will get 25% off, but only through today. So you just add it to your cart, and then in the checkout page, there's a question asking if you have a coupon, and you can just fill it out there. All right, but back to you. And I know you've been waiting for the #1 birth fear. So I've asked on several pages, not just my own, but a few of my friends' pages. I've asked what people's #1 birth fear. And then I've also taught my own prenatal class, and there was a big fear there. And it's crazy. When I first heard about it, I was like, really? That's your #1 birth fear? Because I, as a nurse, had a lot of bigger fears than this one, but it seems to be the #1. But it's pooping on the delivery table. And so a lot of people are really scared that they're going to poop on the delivery table. And it is not something to be concerned about. But if you follow #2, which key #2 was to stay close to nature, it's less likely to happen. If you go into labor naturally, you are less likely to poop on the delivery room table because your body clears out your digestive system for you. It's awfully sweet of it. But a lot of people ask if they can do an enema. We don't really order those anymore. I've even had a couple patients ask their doctors if they could order an enema, and the doctors have refused just because it tends to make it runnier, and it just ends up being so. I do not mind cleaning it up. I do not mind. Nobody knows later. They just remember that beautiful baby and all the good memories that come from that beautiful delivery day. But in the immortal words of Elsa, just let it go. You actually cannot stop yourself from pooping at the same time that you push, because all of those muscles are tied in together. So you can't like clench your poop hole and still have a baby out your baby hole. It's like fighting against yourself, and you definitely don't want to do that, especially on your first delivery. Average pushing time is 2 hours. And so if you're clenching things plus trying to push against it, that's not a I do not mind cleaning it up. I don't even notice it. It's just part of a delivery. I would say that at least 80% of my deliveries end up pooping a little bit, and we just clean it up and we move on. Nobody talks about it. They just remember the beautiful baby. I literally have zero recollection of it. If you ask me, like, between 3 patients that I've had, like, in the last week, if any of them pooped, I would be like, I have no idea. So there you go. It's just part of the job. So the bonus tip of the day is, what is your ultimate goal? And I think the ultimate goal, and again, after this, you guys can start asking questions. We're just about to the end of this. It went a little quicker than I thought it would. So go ahead and start asking your questions in the comments. I'm happy to answer them. But the ultimate goal is definitely a healthy mom and a healthy baby. And that tends to be everyone's comment, or everyone's question, or everyone's goal. They want to have a healthy mom and a healthy baby. Now that your doctor can supersede that by saying, you know, if you don't do this, then, you know, you're not going to have a healthy delivery. But that's why you need informed consent, so they can tell you the risks and the benefits. But the ultimate goal is a healthy mom and a healthy baby. So even if you go into labor thinking that you do not want any Pitocin or an IV, if you end up getting those and you still end up having a healthy mom and a healthy baby, I think you need to feel like that was just fine. There's no reason to be. So you got to keep your eye on the prize, like this little one. And it's amazing how little labor and delivery changes. Like, look at this picture. She could have been today. She could have been a week ago. She could have been 7 years ago. Man, they still have the same ugly blankets and onesie and everything. So, but they do grow up way too fast. I'm sure all of you will learn that soon. Oh, there she is. All right. And no one remembers if you pooped on the table. I probably did, but I have zero idea. And I don't want to ask my husband. He probably doesn't remember. So here we are. We're to the ask questions phase, and I'm excited to answer those. And I'll stay just as long here for a few minutes. If you guys have any questions, I'm happy to answer them. Oh, we have a comment. Yes, Caitlin, average pushing time is 2 hours on the first mom. I think Caitlin, I think, had a C-section on her first one because she was twins. Maybe not. Anyway, it is 2 hours. Some are more, some are less. It's up to you to be able to push good. A lot of people think that the epidural makes it longer, but studies show that the epidural, we tend to let you labor down with an epidural, and so that allows some time for your uterus to bring that baby down without you pushing. But some people might include that on pushing time. So there you go. Average pushing time, though, is 2 hours on your first baby. On subsequent babies, I'm guessing it's like half an hour or less. But you never know. If you have a lot bigger baby the second time, sometimes it's long as well. And if you have a question, you don't need to worry about not getting it in right away. You can always find me at my prenatal class. And I would recommend, if you've enjoyed talking with me tonight, you can always buy the community or the deluxe edition, because those do come with the ability to ask me questions in the Facebook group. I do get people who ask me questions on my email, and I pretty much just direct them to that class. Well, Caitlin is looks like she only pushed 20 minutes for her first and 5 with her second. Well, aren't you special, Caitlin? All right, so there's that class, and I'm just going to hang out here and see if anybody has any questions. Otherwise, I hope to see you guys in my prenatal Facebook group. It would be fun to see you guys there. Maybe people don't have questions. Maybe you guys know everything. I'm just going to hang out here for a couple minutes longer. Maybe you're writing me a novel. Who knows? Let's see. Somebody had a question before. Oh, Jasmine, you had a question before. You got induced but did not feel pressured to do so. Your a little bit of water broke, which sometimes you'll have a huge gush of water breaking, and sometimes you'll have just a little trickle. It depends on where on the amniotic sac your water breaks. Because if you picture the baby living inside a water balloon, if you poke a hole at the top of the water balloon, just a little bit's going to slosh out. But if you poke a hole at the bottom of the balloon, then it's all going to come out. And also the baby's head can cork it off. If the baby's head is well applied to your cervix, sometimes it let fluid out very readily. So once your water is broken though, if you aren't contracting within 4 to 12 hours, usually most doctors will give you up to 12 to try and go on your own, but a lot of times they won't, which of course they should provide you informed consent about if they want to start Pitocin and you're not willing to, or you're not understanding why they want it. So I would recommend, what I would have recommended in that scenario is that you wait a few hours before you got induced to see if your body would kick into labor on its own. And if it didn't, then I would say that you would need some Pitocin. Let's see, we have one. Oh, there's plenty of comments. I'm so excited. What is my opinion on pain management in delivery? I guess my opinion is to stay flexible. So I've always gone into my labors thinking that I wouldn't need an epidural. And then because on my first one, I'm grateful that I did, because I ended up with a forceps delivery and it would have been very painful to have had forceps without an epidural. On my second one, I did get induced. I got augmented, and he ended up being 9 pounds and I just couldn't take it anymore. So I did get an epidural with him. And on my third one, I went in for a full induction, and it is very rare if you're having a full induction, starting out with an induction, for you to do it without any pain management. And I did end up getting an epidural. So if you can do it without an epidural, especially if you have a quick delivery and you can labor a long time at home, then it's great if you don't. My first hospital, we probably only had about a 50% epidural rate, and those women were strong, proud of them. So good for them. So that's my answer for you, Taryn. Jasmine, you're welcome. It's not a big deal. Happy to answer any questions. It looks like I've answered all the questions for the people. Oh, do you think doctors need to have such a strict deadline after your water is broken? It really depends on the hospital and the doctor. So I know some hospitals will let you even go home when your water is broken, as long as you take your temperature every hour, which is essentially all we're doing in the hospital. But do I think they need a deadline? No. I mean, the only thing that can happen once your water breaks is that you can get a fever and develop an infection in your uterus. So that is why they don't want you to labor a long time on your own. So there you go with that. That's what I think about doctors and that. All right, still waiting to see if anybody has any more questions. Doesn't look like we do. So thank you so much for attending this webinar. I really appreciate it. And if you came in late or you're interested in a replay, I should be having that link out soon. And I hope you guys all have a wonderful labor, and that you get the labor that, oh, there's one more question. If you had an episiotomy for your first delivery, is it necessary for the upcoming deliveries? No. The answer to that would be no. An episiotomy should only be cut if it's necessary, and hopefully yours was. I did have I tore on my first delivery, and they told me that every subsequent delivery you're likely to tear, although you don't usually tear as far. So I've always had up to a 2nd degree after my first one, where I had a 4th degree. So it's just likely that you would, just because as the tissue heals, it's not as strong as the tissue used to be. And so it's not always necessary. I do have some people who had an episiotomy or a laceration. An episiotomy is when they cut. A laceration is when you tear. And they didn't end up tearing on the subsequent deliveries. So it looks like we may end up having a couple more questions, which I'm happy to answer. I'll just hang out here for a couple more minutes and see if there's anything else. Just seeing if anyone's... Looks like we're all done. All right, thank you again for attending. Again, no information on this webinar should be taken over the advice of your doctor. Always seek medical attention if you have any questions, if something is an emergency. And ask your nurse, ask your doctor, they're your friend.
again, thank you so much for attending. I appreciate your time, and I appreciate you giving your time to me. And I'll see you around pulling curls. Thanks so much.